Achieving acid control round the clock has always been challenging whenever you take or prescribe any acid-reducing agents. To address the unmet need of our patients and physicians in providing 24-hour acid control, Feroz Sons is proudly launching another innovative product using phenomenal technology with the name of DEXIVA, containing dexlansoprazole. Dexlansoprazole is the only FDA-approved PPI with dual delayed releases of 24-hour acid control in patients 12 years of age and older. Persistent heartburn 2 or more days a week despite treatment and diet changes could be gastroesophageal reflux disease, GERD, also known as acid reflux disease, ARD. GERD is a long-term or chronic digestive disorder. Heartburn and other symptoms of GERD affect different people in different ways and may lead to damage or erosion of lining of esophagus. DEXIVA is the GERD treatment that gives you 2 releases of medicine in 1 pill. With this dual release, DEXIVA is detectable throughout the 24 hours post-dose. Let's see how DEXIVA works to decrease the amount of acid in the stomach. It's the acid that can contribute to the heartburn, one of the symptoms of gastroesophageal reflux disease or GERD. Acid production starts in microscopic pits that line your stomach. Inside these pits, there are special cells called parietal cells containing millions of tiny pumps called proton pumps. These pumps produce acid inside the stomach that helps digest the food you eat. Pumps can be either active or inactive. Only active pumps produce acid. When something happens to trigger the pumps, like food entering your stomach, some of the pumps become active and start producing acid to help digest food you eat. The rest remain inactive until they or newly generated pumps become active and start producing acid. DEXIVA is a type of medicine called proton pump inhibitor or PPI. PPI'S work by helping to shut down acid pumps. The PPI'S don't work on acid pumps when they are inactive because they are not producing acid. DEXIVA has a second release of GERD medicine that arrives later in the day. That's 2 releases of medicine in 1 capsule, and that's why DEXIVA is different. That's how 2 releases work. DEXIVA capsules contain 2 different types of granules that release medicine after you swallow the medicine. The first granule begins releasing medicine within an hour of taking the pill. The second type of granule dissolves and releases medicine around 4 to 5 hours later. Let's see how DEXIVA works in the body. After you take DEXIVA, the granules travel through the stomach to the intestine. The first type of granules begins dissolving within an hour of taking it. DEXIVA then gets absorbed into the bloodstream. After traveling through the bloodstream, DEXIVA enters the parietal cells, where it binds to many of the active acid-producing pumps and helps prevent production of acid. Then, around 4 to 5 hours later, the second type of granules of DEXIVA dissolves, providing the second release of medicine. Once again, DEXIVA gets absorbed into the bloodstream and enters into the parietal cell, where it binds to many of the active acid-producing pumps and helps prevent the production of acid. 24 hours acid control by DEXIVA aids in controlling over nocturnal heartburn and GERD-related sleep disturbance with a single dose. Clinical data supports its beneficial use in reducing GERD symptoms. In a clinical trial, DEXIVA once daily for 6 months provides 96% 24-hour heartburn-free days and 99% heartburn-free nights. DEXIVA helps 88% of the patients to maintain symptoms control after stepping down from twice daily therapy to once daily dose. DEXIVA capsules are used in adults for 4 weeks to treat heartburn related to GERD, for up to 8 weeks to heal acid-related damage to the lining of the esophagus called erosive esophagitis, and for up to 6 months to continue healing of EE, that is erosive esophagitis, and relief of heartburn in adults, and 16 weeks in patients 12 to 17 years of age. Most erosion is shown to heal in 4 to 8 weeks. DEXIVA 30 mg capsules are used in adults for 4 weeks to treat heartburn related to GERD. DEXIVA 60 mg capsules are used for up to 8 weeks to heal acid-related damage to the lining of the esophagus called erosive esophagitis, and for up to 6 months in adults and 16 weeks in patients 12 to 17 years of age to continue healing of erosive esophagitis and relief of heartburn. DEXIVA 30 mg capsules proved to be sufficient in maintenance therapy. Most erosions are shown to heal in 4 to 8 weeks. DEXIVA with 2 release in 1 capsule provides acid control all day, all night.